we're going to be tackling something very important to us here at WKBW, the topic of mental illness. Because here in our community and across the world, just to be completely honest, we have been dealing with a lot over the past year. And so we are going to be exploring this topic in depth.
We certainly are. We're starting our Buffalo Strong conversations, and it's really awesome. I'm excited that we're going to be able to do that. It kicks off today. We'll be covering mental health issues all throughout the month of May, which is Mental Health Awareness Month. And joining us on AM Buffalo this morning to talk a little bit about what we have coming up for you is 7 Eyewitness News senior reporter Eileen Buckley. Good morning, Eileen. Thanks for joining us on AM Buffalo. It's good to see you. Hello. Hi, Eileen. Good morning. Morning, Eileen.
I'm sorry, I'm hearing a lot of garble in my ear right now, and I apologize.
That's okay. I know what it's like to be working from home and doing the show from home, and there's delay, and then it just like, if your Wi-Fi is not so good, it can be a little wild, that's for sure. And you know what, Eileen, I'm not going to use the word crazy, because this is all part of an awareness campaign that we're doing around mental health, our Buffalo Strong Conversations. It's really important for us to consider the language we use when we are talking about mental health, and when we're just talking in everyday life. It's so interesting. There's so many things that we don't think about, and I think that's what our Buffalo Strong Conversations is all about. And it's so great that we're able to do it. Why is it so important for us to do it?
Well, Mel, we're so excited about this because we know that it is not an easy topic to talk about. There is so much stigma surrounding mental health, and it really affects all of us. We really don't think about that, but it's affecting our families. And, the mental health crisis really was here well before the pandemic. When I was in radio, I did a lot of reporting on it and was kind of startled by how prevalent it is in our lives. 1 in 5 Americans will actually experience some sort of a mental health crisis. So that's pretty important to realize of those statistics. The pandemic, of course, has pushed us to new levels. Anxiety and depression in adults has quadrupled with the pandemic. And that's pretty amazing right now, how many people are suffering from those symptoms. We feel that it's so important to have this community conversation to help the mental health experts that are out there that for many years have been trying to break the stigma. But we think that by reporting on this and bringing it to a community level to all of you out there, that this will help. And one thing, we're doing, Mel, of course, you're doing a great story on, mental health first aid training, which I think is so terrific, because I know that'll help people identify these problems, not only with mental health and mental illness, but I believe drug and substance abuse. And then I'll be having another story this evening on how it affects middle schoolers. So again, all very powerful information to help people out there.
That's it. And it is great because it is about empowering ourselves. I mean, it's okay to not be okay, particularly with what we've just been through and are still getting through with the pandemic. So that's okay, and reducing that stigma and knowing that there are things you can do.